Difficult exchanges you've had with a patient, for instance?
With a patient?
Yeah.
We had a patient who was a psychologist, and she was coming in for a transplant. And she was, her behavior, she was very demanding. She threw trays across the room. She was very abusive to the nursing staff, very, inappropriate. And we heard about this before, that she was coming in before she actually came in. And so we sat down with her in a meeting room with the physician and some of us, and we did a contract with the patient, and we said, up front, we understand that you kind of lose it, and you need to know that this behavior is not acceptable. So if it happens while you're in the hospital, the nurse, if you're not in harm's way, if you're not in a dangerous position, the nurse will leave your room, give you a timeout, and then come back in 10 minutes. And so, sure enough, a few days into her admission, the nurse comes over and says, Joyce, she's, throwing trays, she's throwing food. So I went in with the nurse and said, do you remember we had that meeting? And I can see you're not in a dangerous position. We're leaving now, and we'll be back in 10 minutes. And in the meantime, please use this time to settle down. And we left. And, it seemed that behavior modification or that plan seemed to work in that situation for that patient. I heard the next day, however, that she wanted to know, at the time my hair was kind of reddish. This was pre-chemo, and she wanted to know who the red-headed bitch was who was in my room the day before.
She didn't want to face you again, I guess.
No, I guess she didn't. But no, but I think that was a message to the nursing staff, that they can set some limits too, and that they can, that they don't need to accept bad behavior.
Okay, how about an incident with a doctor?
Which one?
I mean, you must be a fantastic trainer of young doctors in how to have appropriate exchanges.
Actually, Dr. Ueno and I have had some conversations with patients. If it was going in to talk to patients about the what-ifs, or it doesn't look like things are going to get better, and I respect him highly for doing that, because he's so concerned about his patients that he wants to get the resources, their skilled resources in there to help with that discussion.
Yeah.
And I think that's very, only admire him for that ability to see other people's skills and to be able to then ask for them to be used. We had a physician who, one of the pompous asses I mentioned yesterday, and I don't know how that translates, very kind of,
How
was it? Very arrogant, very
Goma.
Goma.
What's your first curse word in Japanese?
It's not a curse word.
It's not a curse word. Anyway, he was, we had some issues before. I made some suggestions. He totally discounted them, like I didn't know what I was talking about. So there was a new situation coming up, and so I was trying to get reinforcements. So I paged my boss, my chairman of the department, because I wanted him to be aware of this situation and get advice or whatever. Well, the chairman of the department, unfortunately, was out of town. So who answers his page but another physician? The other physician happens to be the wife of the doctor that I'm trying to negotiate with. And she said, well, why don't you just, I said, you know, this is the situation. I feel like the physician is going to say the patient should be discharged, and none of us thought the patient should be discharged. And he was just going to bully his way into getting what he wanted. And I was kind of trying to get, you know, reinforcement to say, no, the patient shouldn't be discharged. And so she talked to me. I said, well, this is kind of awkward situation. You know, it's your husband that you know. So I went on and told her about the situation, and she, of course, well, why did you call him? And I said, well, I was trying to get some more information or suggestions before I did this. And so she, of course, then just said, you know, well, I'll talk to him. I said, no, let's see how this issue resolves. And she said, no, I'll take care of it, And I said, no, don't, that's okay. It was like, I didn't want the boat to stir too much. I said, you know, he seems to have an issue with kind of assertiveness women. I said this about her husband. She said, well, I'm an assertive woman. I said, yes, but you have a slightly different relationship with him than I do. So,
You sleep with him.
yeah, I sleep with him. I don't think but anyway, so, you know, she ended up talking to him. I did page him an hour or so later, and I don't understand why you didn't just talk to me. And I said, well, sometimes I don't always feel like you listen to what I have to say. So that was an important conversation to have with him too. So,
okay, last question. What are you still learning? What do you hope to accomplish in the rest of it? What's kind of a double-barrel question?
I think I'm very excited still from what I do in my professional life, and the opportunities to come here and to learn more about the Japanese culture and to do some joint research projects, I think is very exciting. I want to finish my dissertation. Before I retire. I want to continue to do research. Much like, I think, integration of nursing research into clinical practice is very important. And like the physician model, where they do clinical practice, they see patients, and then they also do their research, I would like to hopefully do at least some of that model in my career, for the rest of my career.
Thank you very much. Thanks, Joyce.